Today's discussion will be on a topic which is sometimes much more common than we would like to accept it. It's called multiple traumas involving either motor vehicle accidents or from falls or any other gunshot wounds, etc. Over the last 72 hours, I was involved in a very, very close relative of mine who was involved in a motor vehicle accident. It was, in fact, a very surreal thing that she was at a gas station just pumping her gas when two cars collided from another location and actually pinned her, went over the guardrail and actually pinned her against the gas pump when she was pumping gas at the back of a car. My only reason for telling you this is that basically the way accidents happen, none of us can predict. And unfortunate for her that she was pinned with quite a tremendous amount of force. This dear relative of mine is alive and well, but the last 48 to 72 hours were very, very serious situations to deal with. And as such, I will try and explain to you some of the situations that occur or some of the things you can actually be aware of that could occur immediately after severe multiple trauma injuries, as happened in the case of this dear cousin of mine. The issue with that is if you are made aware of it, at least you can be able to ask your doctors the pertinent questions, especially when you're there in the state of worry and anxiety and not quite sure what the eventual prognosis is going to be. In the case of my cousin Esther, the issue here was basically she sustained injuries to the head, to the neck, to the ribs, to the pelvic bones, and multiple soft tissue injury involving the legs. So much so that she lost consciousness and evidence of cerebral edema. But let me generalize this to the average patient who's involved in an incident, whether it be a fall from a height or involved in a motor vehicle accident or any other trauma in which result in multiple injuries. Multiple injuries is basically injuries that occur in more than one body area. If we look at the mannequin, for instance, in her case, she had trauma to the head, having been pinned against a gas pump by a motor vehicle, and the impact force of it actually caused cerebral edema. You imagine that there's an accelerating and a decelerating injury when you actually get a severe blunt trauma with a hit to the head. You will get bleeding within. Small bleedings to give you enough of a headache, so much so you can get post-concussion headaches. Imagine being hit by a motor vehicle with an impact force of 30 miles per hour against something that is still, the impact force created actually causes a jarring of the meninges of the brain and could actually cause bleeding. It can result in much more sinister bleeding in terms of things like subarachnoid hemorrhages, subdural hematomas that can actually cause blood to actually spread within the brain linings, outside of the brain linings, and inside of the skull, and those can actually cause increased intracranial pressure, cause coning, cause respiratory failure, and immediate death in a very short period of time. So whilst you're there with your relative at the time when you're actually there, always the question is, are you okay? Is things okay? And make sure that they're aware of what's going on. Do you know who's in front of you? Those are the very, very subtle signs that basically there's nothing going on with the brain at the time, or very little going on with the brain in terms of bleeding within the brain. So whilst you're there with your relative, it's important for you to know that carrying on a conversation with them and they're awake and alert makes you feel good, that at least there's nothing. But in the event of that person actually now going from a cognizant state in which they recognize you to a state of which they're not even able to recognize you, then you start to ask the doctor's question immediately, doctor, is my relative okay? Is there any signs of bleeding within the brain? Because now she was coherent and being able to discuss things with me lucidly, and now she's not able to discuss lucidly. That's a sign that basically there's evidence of cerebral edema, or it could be even as a result of the drugs that you take. But you at least need to be able to address that situation with the nurse or the doctor in charge at the time it's happening. So being there is important for you to observe, to talk, to engage. At the same time when you do that, you're able to establish in your own minds that your relative is awake and alert, because the most serious injury is to the brain. You also look at the eyes themselves. Are the eyes nice and focused, or they glaze? Are they looking as if they're looking beyond you? Those are not good signs. Are the eyes fixed? Sometimes we put you on a ventilator after an injury to decrease the cerebral edema. We put you on steroids as well at times to decrease that cerebral edema. But the ventilator itself, you have to at least make sure that the person is knocked out before you actually put them on the ventilator. So at the time you ask them, is the state of consciousness of my relative a reflection of the ventilator you put them on, or is it a reflection of the injury sustained to the brain? Those are questions you need to ask and make sure you're aware of it, so you're there monitoring yourself, because no one will have more interest with your loved ones than you yourself. The other injuries that we tend to look for is evidence of bleeding from the ear, the nose, the throat, and make sure there's no fresh blood coming from it. Obviously, soft tissue into the face will result in bleeding in those particular areas. And you can actually recognize it by peeping up the nose into the mouth itself. You also look to see if there's a tracheostomy tube, which makes you aware that that tube is in the trachea, allowing your relative to breathe. What that does, the ventilator then breathes for the person at a time. If there's evidence of facial fractures, then in that case, to stabilize the face and allow breathing not to take place through the mouth, you may end up having a tracheostomy tube put there, or you might have an endotracheal tube through the mouth, at the side, pinned to the side of the mouth, and going into the respiratory tract. It doesn't mean that your relative is much worse off because of the tracheostomy tube. There may be the reason for the tracheostomy tube to assist in creating an airway, an air passage, so that the machine can breathe for them, but also it makes you aware that there's something else going on above the head. That in itself, it looks much more sinister than it should, but for us, we need to at least make sure that that tube is patent at all times and the relative is not gasping. When we look at that endotracheal tube as well, it can be planted on the side of the mouth, and it doesn't look very, very nice. It doesn't look very aesthetic, and it makes us feel afraid that something else is happening. But it also makes you aware that there's evidence of trauma to the face itself, or there's compromise involving the proximal part of the breathing mechanism. The other major thing we worry for, especially with these severe blunt trauma that occur, is the evidence of the injury to the neck. Cervical fractures, even though not common, or cervical displaced fractures, even though common, the long-term sequelae or the immediate sequelae of a transection of the cervical cord is in itself a very, very serious injury, because transection that occur of the cervical cord or the vertebral cord over the cervical region, if it involves the area above the second and the third cervical vertebrae, can result in immediate death. If it occurs below that, it can suppress the respiratory center. If it occurs below that, say C5, C6, then you're completely paralyzed. The chances of recovery after those injuries are basically slim. The issue with long-term rehab and being able to rehabilitate yourself from those injuries sometimes is much more a promise. And I have yet to see somebody who's had transection of the cervical cord or subluxation of the cervical spine without having an operation really recover to the extent. Yes, you can walk, and that's a gift. The issue about that, a lot of times you end up being a paraplegic. And basically the rest of your life spent in rehabilitation, etc. But worse than that, most of your bodily functions are affected. In the next discussion, we will continue where we left off, at least injury to the cervical spine. So we try and focus, at least today, on that cousin of mine involving an incident, an accident as it was, and for your relatives, what to look out for when you actually go to the intensive care, or you go to the multiple trauma center, or you go to the emergency room. Look for those signs in the head, neck, ear, nose, and throat, especially the signs of coherency in terms of discussion. That is all for now. In the next discussion, we'll try and look at the other parts from the neck downwards in terms of multiple traumas. Thank you. We will continue our discussion on multiple traumas to the body, especially after things like motor vehicle accident. And coming back to the case of my cousin Esther, who was involved in a motor vehicle accident, in fact, severe blunt trauma to the body after being pinned against a gas pump, just standing at a gas pump, pumping gas. It shows us that accidents can occur anywhere, so at all times we should be prepared. What is common to it is what do we do after those incidents in which we feel that the life of our relatives or the life of our very close ones are being threatened. In the last discussion, we mentioned some of the signs that we look for involving the head, the way your relative is looking at you, not with glazed eyes. They're able to focus on you. They're able to communicate coherently with you. They not have obvious evidence of bleeding from ear, nose, and throat, even though they're in the emergency room or in the intensive care unit. At least if you're aware of some of the factors, that some of the complications of head injuries at the time of an incident like this, an accident, when you're still waiting for the signs and symptoms of head injuries or other injuries to develop. We mentioned the subtle signs of bleeding within the brain, from increasing headaches to not being able to focus to total loss of consciousness. Total loss of consciousness for us is a very sinister sign. It means there's bleeding within the brain itself. We mentioned bleeding within the brain does not only occur in the brain parenchyma itself, not only the brain. It can occur within the meninges, the linings of the brain. It can occur within the lining of the brain, the outside lining of the brain, and the interior lining of the skull, which is a subdural hematoma, which can actually cause coning and actually cause the brain stem to become compressed and actually cause death in a very short period of time. We also mentioned the way when we look into the emergency room, we find the evidence of breathing mechanisms to help the lungs to expand. They're not as bad as they look, but it also alerts you that there are additional injuries that are taking place, either within the lungs itself or within the proximal portion, the pharynx, the trachea, the bronchus, the proximal portion of the bronchus, or the trachea itself. Obviously, the implant of a tracheostomy tube, after having an endotracheal tube in your mouth for a while to assist you with ventilation, means that the injuries that are occurring are probably going to take a longer time to heal. Now, when we look at the trauma that takes place, one thing we discussed the last time was injury to the neck. Because after such a severe impact injury, with a whiplash injury, with a hyperextension, hyperflexion force of it, you can actually cause the damage to the spinal cord itself, but you could also cause damage to the vertebral column. Damage to the vertebral column, whether or not be a stable fracture or an unstable fracture, can actually result in compression of the nerve root as it comes off the spinal cord. Remember the nerve root that actually supplies the arm itself, C5, 6, 7, and 8. When we look at the neck, let's say this is the portion of the neck we have here, C1, 2, 3, 4, 5, 6, 7, 8. When we look at it, this one controls the diaphragm, C2, 3, and basically if it's damaged or transection of the cord, you will not be able to have diaphragmatic breathing. You also can suppress the respiratory center and the cardiovascular center and cause immediate death. The injuries below C5, 6, 7 result in injuries to the heart, and if it actually results in transection of the cord, meaning the injury to the neck itself, if it's stable, if it involves the vertebral column, even if it's a crush injury and it's stable, it will not compromise the vertebral, the nerve root as it comes out, or the vertebral, or the spinal cord, as it comes through the neck. Remember, the issue about the neck injuries, it's not how bad the bone looks, but what is the integrity of the spinal column, that actually when the spinal cord comes through that particular spinal column, and the nerve root that comes out from the ends of those, especially in these areas when we're looking at them. This is the vertebral artery here, but this is the spinal cord. The issue about that, if the spinal cord is compressed, that will result in nerve deficit from that level all the way down. So it becomes a very serious injury. Going back to the case of my cousin, basically she had fractures involving the ribs, C7, C6, C7, C8, on the right side, on this side. So let's put this diagram against here. If she had fractures involving the rib fractures, of the 12 ribs we have, basically she had fractures involving the 6 and the 7, which is under the breast itself, and I think 8 and 9. But let's look at where this is in terms of the chest wall. So you're having fractures over, obviously impact to the breast, you're going to have soft tissue injury to the breast itself, and obviously pain. But what lies behind it is the lungs on the upper part, and below that lies the liver. In her case, she had difficulty breathing. So the issue here at that time was whether or not, with the rib fractures, if in fact there were evidence of rib fractures involving two segments here, what happens in that, you get a flail segment. And then now you're unable to breathe because that segment is now broken. And every time you take a big breath in, it goes in and out, and you're not able to have a proper respiratory excursion. In addition to that, multiple fractures to the rib results in injury to the lungs itself. But where does that injury occur? Does it occur in the lung parenchyma itself, the body of the lungs? No, a lot of times that injury takes place on the pleural cavity, where it is bleeding into the area between the pleural space. Blood into the pleural space will prevent the lungs from expanding. Also, in addition to that, you have to put a thoracostomy tube in order to drain the lungs. You can also have a complete collapse of that lungs on that side, causing the entire thoracic cavity to shift to one side. Just imagine this lung is collapsed. That empty space now created caused the heart to be shifted to the right side, and now that lungs re-expand to the other side. So now what you have now is not only the fact you can actually cause the entire thoracic cavity to be shifted to one side, severe difficulty breathing, but also at that point in time start to compromise the cardiac function as well. So injuries to the chest itself, at least you have to understand, if you have a relative with an injury to the chest and the doctor is telling you there are multiple fractures to the rib cage itself, try and understand from your own anatomy what is beneath that injury. You look at the fracture to the rib and the upper part of the rib. Let's say it starts from the level of the first, second, third, fourth, fifth, sixth, seventh rib. And we basically say that will involve the chest cavity. So we look upon it, what is behind that chest cavity. We've got the breast, obviously, soft tissue injury, a lot of pain, but it's not going to result in anything that's going to be an emergency. What happens behind that becomes the issue. Is it a fracture involving the rib cage that's now causing it can cause a tremendous amount of pain because the nerve fibers run under that. And because the rib is itself, as we see in animals themselves, the lining of the rib itself is extremely painful when fractured. But the more serious signs of it is what happens behind the rib cage in the pleural cavity. Is there evidence of air being sucked in, so much so that the pleural space is now compressing the lungs, and you're compromising that lungs and causing that lungs to collapse? Can the fracture to the rib cause bleeding within the pleural space? That is also going to compromise the breathing and cause the thoracic cavity to shift to the other side. But worst of all, what it does, it causes you to have the inability of not being able to breathe properly. It can also compromise your cardiovascular function, either by a mechanical effect of compressing the thoracic cavity, or the simple fact of basically just the effusion of blood, and actually can result in severe anemia at that time, but can cause sudden death. I'm going to try and elaborate a little bit more on the thoracic injuries that can occur after multiple traumas to the rib, and how it can also impact on the intra-abdominal findings. That is all for now. Thank you. Let us continue our discussion on multiple traumas from blunt injuries, whether it be motor vehicle accidents, falls, etc. We discuss injury to the head, and in terms of the skull, the brain itself, injuries to the head, neck, ear, nose, and throat region. We also discuss injuries to do with the cervical spine, and the long-term sequelae, short and long-term sequelae of severe injuries to the spine. Complete transection of the cord below the levels of C5 can cause total paralysis. Above the level of C4 can actually cause sudden death by compression of the cardiovascular and the respiratory center, in a case in which we describe as coning, in which the brainstem actually sinks beneath, the levels compressed beneath the skull into the cerebellum, everything cones down into the below the foramen magnum. So now the respiratory center, instead of being within the brain itself, within the head itself, now is in the neck, that's now compressed, and we have sudden death. I did in fact have a relative who died from that after plunging into a shallow creek. Injuries below the neck can actually cause transection of the cord itself, and that can cause various levels of paralysis, depending on whether that transection is complete. Transection, all it means is that the integrity of that spinal cord itself is either contused, meaning it's just bruise, which means it can repair itself over time, either surgically or non-surgically, whether by physical therapy, long-term physical therapy, or in fact if there's evidence of compression of the cord itself from decompression by a surgical procedure. Not necessarily an open laminectomy where you open the bones themselves, but probably just realign the portions of the bone that protect the spinal cord. Sometimes when we describe injuries to the neck itself, we say that there's crush injuries, but stable. You want to hear the word stable to make sure that your relative is not going to have compromise of the spinal cord. So you're not worried about how the fracture is, if it's a crush injury. Sometimes a lot of crush injuries from falls. If the integrity of the spinal column is maintained, that's good news for you. If in fact the level of sometimes even a small fracture, but it's unstable, and can actually cause compression of the nerve root that comes out through the cervical column, then in fact we worry tremendously because of the long-term sequelae, short and long-term sequelae of decreased range of movement involving upper limbs and the rest of the body as well. Because you remember when the spinal cord itself from the neck, the rest of the body goes with it. Whatever level you have an injury to the spinal cord, it affects the body below that. Let's say we have injury to the lumbar spine. It affects the area below the lumbar spine, but does not affect the area above the lumbar spine. However, injury to the neck itself will affect the rest of the spinal cord below that region, which includes your arms, your legs, everything else. Remember, because the vertebral column is made up of the cervical spine, the thoracic spine, the lumbar spine, and the sacral spine. And basically, they all supply innervation. At another time, we'll try and discuss how those nerve roots affect the different parts of the body. Suffice it to say now, cervical injuries in themselves are considered life-threatening to the point of where we actually treat them at the site of a trauma with probably the most precautions you ever can. But here again, the two things you're faced with is injury to the cervical spine and the integrity of the lungs itself. If we look at this diagram, a lot of times we go into the multiple trauma center or in the intensive care with our relatives and see that they have tubes implanted. The main purpose of that tube, whether it be an endotracheal tube that either goes through the nose into the back of the pharynx, into the esophagus, allows us to breathe. The main thing is to get air into your lungs. Or you have an endotracheal tube where we make an opening beneath the thyroid cartilage and send it all the way down into the trachea. In that case, you now know that the lungs itself can be able to breathe. The purpose of creating an artificial passage is to make sure that eventually you're getting air into the lungs. The rate is being controlled by the machine. The amount of air being sent in, the amount of oxygen being sent in and expelled is also controlled. The way you measure this is measure the blood gas to make sure that whatever oxygen you're giving is adequate enough, so at least your partial pressure of your oxygen is enough that you used to have before. The issue with that is that why we need to breathe for you at that point in time is because your lungs either has collapsed in itself, either the fact of the collapse from the outside, meaning the pleural space, over the lungs itself either has air, which now compresses the lungs inward, or it has blood or other fluids within it. Now that fluid needs to be drained. What we tend to do then is to pass a thoracostomy tube through the skin into a bag that sucks the blood out and allows the lungs to re-expand. But that in itself takes time to happen as well. In that case, you prevent that swelling, that fluid that's accumulating, that is going to cause that lung to compress. When it compresses, the lung itself compresses, but it pushes the rest of the thorax to the other side, which compromises and can cause even kinking of the good lungs itself. It can also, in a severe case, cause kinking of the aorta and the larger blood vessels within it. But in addition to that, when you have fractures of the rib, you can also have fractures and perforation of the lungs itself and cause bleeding within the lung parenchyma. But worst of all, having the fractures actually cause perforation of the linings of the heart and can cause a cardiac tamponade, meaning now instead of the lining around the heart itself, now we actually have blood in that closed cavity. Now it's preventing your heart supposed to be pumping without any pressure around it. It has the lining around the heart itself that separates the outer lining of the heart and the muscle walls and the blood vessels that run thereof. If it were to be ruptured or perforated with even a puncture wound, it can cause blood to accumulate within that cardiac cavity outside the heart, now preventing the heart from contracting. Cardiac tamponade can result in sudden death. So all of these things need to look upon. If you see a low voltage EKG, when you actually do the EKG at the time that you're seeing the patient, or the EKG has changed from a normal EKG to a low voltage EKG, it's time to start worrying. If the heart rate has actually sped up tremendously, looking at the EKG, then you worry whether or not that patient is actively bleeding or there's a compromise to the cardiovascular system. That means, is the heart itself pumping enough blood? Is the lungs itself being perfused with enough oxygen? And those are the things that make us worry tremendously. In the case of my good cousin, she also had fractures involving the lower ribs itself. Those fractures are involving the 8th and the 9th rib over the right-hand side. Now, when we look at fractures involved in that, obviously she had severe blunt trauma to that area, and that was over the liver. Her blood count dropped dramatically from, I think, around 11 to something like 8, which made us understand that there was bleeding. Once it was ruled out from the lungs in terms of having a CAT scan and our oxygen levels were okay, and we knew that she was able to breathe alone except for severe amount of pain and being aided by a ventilator at least for a short period of time, the focus had to be whether or not there was bleeding from the intra-abdominal cavity. And bleeding from the intra-abdominal cavity, you look for the obvious sign. There was a fracture involving the rib, the lower side. Let's go back to this diagram. These were where the fractures were. Obviously, what lies beneath that is your liver. And here again, I'm telling you this not to make physicians out of us, but to make us understand that when we're looking at our relatives objectively, you're faced with them face to face. And you can look at them very objectively by how they respond to you, their level of coherence, how they looked, what they're capable of doing, and put into perspective what the doctor's telling you. You have a fractured skull, but your brain is okay. You have a fracture involving the neck, but it's stable. You have a fracture involving the lungs, the rib cage itself, but the lungs are stable. So you're able to put into perspective what injuries your relative has in terms of that particular patient. Because for you, that is the most important person on earth for you who is in danger. And by being aware of what a simple approach as to where the injuries are, you can be able to ask good questions, proper questions, but also make the doctors and nurses aware when you are seeing subtle changes that are taking place in your relative. It creates within that physician or within that medical team the level of awareness that that person is not there just looking at their relatives and taking flowers and trying to be sympathetic. They're there with a perspective eye. I'm here to make sure you live regardless of everything else. I'm here to observe and to understand that this is what you were prior to the incident, the accident. Now this is what I want you to be at the end of that. So throughout the entire period, you're aware of what those injuries are, and you're able to ask the doctor, is my mother's brain function, is my sister's brain function getting better? Is the injury to the neck going to affect her? How much more do we need to do? What do we expect in the future? So the questions that you ask are the ones that make the medical team understand that you know something of injuries and you're able to assist that person, not because you did not have any formal medical training, means you cannot ask proper questions. You definitely can ask proper questions. But you make the team aware that you know what are the questions to ask. So they are also aware, did I miss this? And they ask themselves questions. And us as physicians always do that. You ask a question by a relative, you don't dismiss it because you think you're the doctor in charge. It plays in your mind for a while longer, and then you address it. And when you see that relative, you address that identical question that was asked because you're aware that people there have a level of knowledge, but your interest is not against litigation. Your interest is, let me make this patient survive to the best of my knowledge. But I'm also want the assistance of the relative to say to me, ask me the right questions, and I'll give you the proper answers. So you're aware what to expect of your relative at the time they're recovering, at the time they're discharged, and what to expect as long-term sequelae. That is all for now, and we'll continue this discussion on multiple trauma. Thank you. As we continue our discussion on multiple traumas involving the body itself, and we start to have an approach that we as patients can have when we enter into the hospital setting, not only are we overwhelmed with the fact that a relative has been involved in a serious accident or incident, but we were able to put our feelings a little bit aside as we try and evaluate what are the proper questions, what are the important questions we should be asking the medical team. We may not all be at the same level of function and in terms of expertise in medicine, but at least we should all have some idea as to what are some of the more common things that occur. And even if you're told something, you're able to ask a further question as to say, what is it that I can expect if there's an injury to, say, the head, to the neck, to the chest, to the abdomen, to the pelvis? What are some of the further questions I can ask the medical team, so at least I know what is the best scenario, what is the worst scenario? Even 2 questions to be asked. The purpose of these talks are mainly to educate the layperson as to the questions and the things that you face with, or some of the things that you see when you enter into a trauma center or see your relative in a bed in intensive care or going through rehab subsequent to an injury, subsequently to severe injuries. The purpose is not to give you a complete medical education, because that is not going to be possible. But if we are able to understand the process, we're able to ask the proper questions, and we're able to get proper answers from the relatives who know a little bit more. A lot of times I go into these trauma centers, and actually when my days of working in the emergency room, etc., I see the faces of patients or relatives being totally overwhelmed by seeing their loved ones in straps, in tubes, all over the place, in drips going left, right, and center, remembering what they were before and now seeing what they are now. I had that similar experience just a couple of days ago with a very close cousin of mine, and I understand it a little bit more now, or having revisited that situation. What is it that we as patients tend to go through when we see our loved ones and we get overwhelmed with the tubes, etc., and the lines, etc. But I know fully well that if we step back a little bit, there must be some family member who can take charge and say, let me take charge of the medical aspect. The emotional aspect, obviously, as a mother, there's nothing can separate you from your child, or as a child from your mother. Those feelings are difficult to get beyond the look of the person to get to where the tubes are. And it's sometimes even difficult for a physician who's gone through this on numerous occasions in their life, or probably go through it on an everyday basis, to even fathom, to think when they see their child there, or their mother there, or the rest of their family there, they're not able to separate. And it's difficult at times to separate it. But what I'm asking here is that even when you're there and you find that they're recovering and you separate the emotional aspect, try and focus on where things are and where the injuries are. For instance, injuries to the head, to the neck, to the thorax. You're able to put them in perspective in terms of, is it going to affect brain function? Is it going to affect breathing if it happens in the neck? Is it going to affect the function of the limbs because of the spinal cord? In the thoracic function, is it going to have long-term sequelae in terms of lung function or cardiac function? The last 4 discussions, we elaborated tremendously on those particular regions. Let me go back to the same relative of mine, Esther, basically with the fracture that she had involving the rib. Her hemoglobin dropped tremendously. So we wanted to know whether